Warning, what you're about to see is pretty gross.
What's he using to head it?
It's a big slotted mallet. So with orthopedics, it's a lot of drills, a lot of mallets. It's almost like woodworking in a way.
Viewer discretion is advised. I am in the waiting room of Dr. Kevin Debiparshad. He specializes in limb lengthening surgery.
Initially, it was used for correction of deformities. If you're born with a shorter leg, if you get into a car accident and you lose part of your leg, we're able to get the area to heal as well as lengthen it to correct that deformity. Now, as technology has gotten better, implants have gotten better, it's become more minimally invasive to do the process. We're able to even offer this procedure as a cosmetic type of enhancement. These are femoral nails, so they actually go into the thigh bone. You can kind of see there's screws on top and there's screws on bottom. You can kind of see this is a two-part device, right? It's a telescopic device. There's actually a magnet inside, which is why these kind of connect, obviously, because it's a magnet that moves the gearbox inside. We have a remote control that is actually also a magnet that spins the magnet inside. The patient takes with them and can control the implant with this. That allows the implant to actually move. Typically in a femur, we may lengthen that bone about 1 millimeter or so a day. So patients can expect to gain somewhere between about 1 inch or so in 25 days.
The surgery takes about 1.5 hours to complete. The cost can run in the tens of thousands, but if paid up front, can typically be around $100,000. Dr. D says patients do this kind of surgery for a number of reasons.
Overall, they feel that they're lacking this particular characteristic about themselves, or there's something that, should they have this additional height, could make them just feel that much more confident and feel that much more, comfortable in their own skin, and that's why they kind of pursue it. I think a lot of people assume that the motivation is to attract the opposite sex, so the same sex to find a partner. A lot of my patients are married. What we see in people's motivations is that they can be quite varied. We've seen a growing number of patients, particularly female patients, as well as the transgender population, that have looked at pursuing shortening procedures so that they can feel more like who they identify with.
When people think of leg lengthening surgery, I think the hardest part that they imagine is the bone getting broken, the surgery itself.
So see this kind of darker shade right here? This darker shade is coracal bone. That's why you hear a lot of bone shatter. We're trying to thin this out to make room for this implant.
But actually, that's just the start of the journey. The hard part really comes in recovery, learning how to walk again, using a walker, using a wheelchair, and really doing physical therapy and stretching and committing to that recovery process. Unlike other cosmetic surgeries, this is a recovery process that extends out for months, and it can take 1 year to get back to full athleticism. Like after a year mark is typically when people start to get that progress again.